Good day everyone, and welcome to today's training presentation titled Mastering Safety and Compliance by Vactal's Residential Care Center. This session is designed to review important facility standard practices and compliance requirements to ensure we continue providing a safe, organized and high-quality environment for our clients. Your attention, participation and commitment to these guidelines are greatly appreciated as we work together to uphold excellence, accountability and professionalism in our facility.
Imagine a world where medication errors are a thing of the past. By ensuring all medications are stored in a locked, centralized area, we take the first step towards this reality. The Medication Administration Record MAR is our roadmap. Verify that it's properly signed and initialed to ensure every dose is accounted for. Administering medications correctly is crucial. Check that bubbles are empty to prevent dosage errors and ensure client safety. A clean, sanitary facility is non-negotiable. Regular maintenance keeps our environment safe and welcoming for everyone. Clear passageways are essential. Ensure all potential hazards are free of obstructions to prevent accidents. Safety around water is paramount. Secure pools with appropriate fencing to protect our clients.
The following information outlines important safety and compliance standards that all staff need to know and consistently follow. The facility maintains a locked storage area for firearms, poisons, and other dangerous weapons, with a separate locked storage area designated for ammunition. The laundry area and all cleaning chemicals remain secured at all times. All window screens are clean and maintained in good repair. The facility temperature is consistently maintained between 68 and 85 degrees to ensure resident comfort and safety. Fireplaces and open-faced heaters are kept inaccessible to clients. Stairways, inclines, ramps, open porches, and other areas of potential hazard are well lit and equipped with sturdy hand railings. Fire alarms and smoke alarms are fully operational, and carbon monoxide detectors are functioning properly. XIT signs are clearly posted above doors. The side yard entry and exit remain unlocked for emergency egress. Gardening tools, hand tools, and similar equipment are securely stored in the garage and kept away from residents.
Bedrooms should be spacious and accessible. This ensures comfort and ease of movement for all clients. Each client deserves a clean, flame-retardant bed and ample storage space. This promotes a sense of ownership and comfort. Emergency evacuation routes must be accessible, even in bedrooms with security bars. Safety is our top priority.
The following information outlines bedroom furnishing requirements that staff need to be aware of and ensure are maintained at all times. Each client must have a dresser and closet space that includes at least 2 drawers, or a minimum of 8 cubic feet of dresser space per client. In addition, each client must have a chair and a lamp available for personal use, and there must be at least 1 nightstand provided for every 2 clients to ensure adequate accessibility and comfort.
Bathrooms should be sufficient for all clients and staff. Maintain a ratio of 1 toilet and wash basin per 6 individuals. Regulate hot water temperatures between 105 and 120 degrees Fahrenheit to prevent scalding and ensure comfort. Install nightlights in hallways outside non-private bathrooms. This simple step enhances nighttime safety. Personal hygiene supplies and PPE should always be well stocked. This ensures readiness and hygiene at all times. Maintain a sufficient supply of clean linens for regular changes. This promotes cleanliness and comfort for our clients. Keep a stock of cleaning and kitchen supplies. This supports daily operations and maintains a sanitary environment.
The following information highlights supply expectations that staff must consistently monitor and maintain. Personal protective equipment (PPE), including gloves, hand sanitizers, gowns, head covers, foot covers, face shields, and masks, must be properly stocked at all times. In addition, essential resident care items such as diapers, diaper creams, and peri-wash must remain adequately supplied. Household and operational supplies, including dishwashing liquid, hand soap, detergents, paper towels, tissue paper, napkins, medication cups, trash bags, and other necessary extra supplies, must also be fully stocked to ensure continuous, safe, and sanitary facility operations.
The dining room should be near the kitchen for convenience. This layout enhances meal service efficiency. Ensure refrigerators and freezers are clean and at correct temperatures. This prevents food spoilage and ensures safety. Maintain a 7-day supply of non-perishable food and water. This preparation is crucial for emergencies.
The following kitchen and food service standards are important for all staff to understand and consistently maintain. All food items in the refrigerator must be properly labeled with the date opened and the expiration date. The freezer temperature must be maintained at 0 degrees Fahrenheit, and the refrigerator must not exceed 45 degrees Fahrenheit. The facility must maintain at least a 7-day supply of water at 1 gallon per person per day, including both clients and staff. There must be sufficient amounts of tableware, tables, dishes, and utensils available, along with adequate equipment for the storage, preparation, and service of food. All knives and sharp objects must be kept locked. All equipment, dishes, and utensils must be clean and well maintained, and all kitchen, food storage, and preparation areas must remain clean at all times. The weekly menu must be posted, and staff should regularly verify that the menu aligns with the available groceries and supplies.
Store personnel and client records confidentially. Keeping records updated with necessary tests and training is essential for compliance.
All employee records must be properly maintained and kept up to date. This includes first aid certification, TB test results, health screenings, identification, monthly trainings, and COVID test records when required. Staff must also receive zero tolerance and whistleblower policy training annually to ensure compliance with regulations and to maintain a safe and ethical workplace. Client records must also be updated regularly, including the physician's report and TB test, which must be renewed annually. Facilities must conduct and properly document fire evacuation drills to ensure preparedness in case of emergencies. All client records must be stored confidentially and securely within the facility. Additionally, clients must have documented activity records, temperature monitoring records, and updated behavior tallies. Ongoing review of client notes should also be conducted to ensure documentation is accurate, current, and compliant with regulatory standards. The facility must ensure that the emergency exit plan and emergency phone numbers are clearly posted at all times. Clients' personal rights, including both sides of the LIC 613 form, the facility visiting policy, and the licensing complaint poster must also be visibly posted. A designated space must be available for resident council meetings and postings. In addition, the staff schedule and updated client and staff rosters must be current and posted for reference.
Provide outdoor activity spaces with shaded areas. Ensure common rooms are available for client visitors to foster community engagement. The facility must provide at least one common room for visitors and ensure that activity supplies, including newspapers, magazines, and a variety of reading materials, are available for clients.
Lastly, the facility must maintain complete first aid supplies, proper laundry space with separate areas for clean and soiled linens, an operating telephone accessible to clients, emergency lighting and safe and well-maintained vehicles for client laskas, required transportation, required health postings, and adherence to infection control practices such as staff wearing masks. Maintaining full facility compliance is essential to ensuring a safe, respectful, and well-managed environment, and it remains our collective responsibility to consistently follow all regulations, uphold professional standards, and prioritize the health and well-being of our clients at all times.